Okay, let's jump right in. Today we're doing a deep dive into something genuinely important for your health. How to recognize certain signals your body might be sending, specifically about colon health. We're digging into a really practical article here, one that lays out some key warning signs you really shouldn't brush aside.
Yeah, and the goal for this deep dive is really just to pull out the absolute core of that information for you. Colon health, it's one of those topics. It can feel a bit abstract maybe,
Yeah.
but issues are incredibly common. And frankly, knowing these signs early, it can make a life-changing difference. This article gives a very clear guide.
Absolutely. So let's unpack what this source highlights. It seems to focus on, what, four particular signals? What's the first one it really emphasizes for us to pay attention to?
Okay, so it zeroes in on persistent changes in your bowel habits.
Persistent changes.
Okay. Yeah, so think about what's normal for you. Is it suddenly like lasting diarrhea?
Yeah.
Or maybe constipation that just won't go away, or even just a noticeable shift, in the consistency of your stool.
Yeah.
If that change sticks around for more than a few days, the article flags it as something worth investigating.
Right, right. Your body's routine getting disrupted like that, that's a pretty clear indicator something might be off. Okay, so what's the next critical sign this article points out?
The next one is blood.
Blood. Okay.
Seeing blood when you go to the bathroom.
Mm-hmm.
Could be bright red, in the toilet or on the paper.
Mm.
Or even if your stool looks dark and carry, that's another sign mentioned.
Uh-huh.
The article is really clear that this needs a checkup. Now, it could be something minor like hemorrhoids. It does mention that.
Sure.
But it strongly advises against just assuming that. It urges you to get professional medical advice. Don't guess.
Yeah, definitely don't want to guess with that one. Okay, here's where it gets kind of interesting. This article mentions a sign that, well, might not immediately make you think colon health. What's number 3 on their list?
That would be unexplained weight loss.
Unexplained.
Yeah, the kind where you're losing weight, but you haven't changed your diet, you haven't changed your exercise routine at all, you're not trying to lose weight.
Hmm.
And the article suggests this can happen because, well, maybe a growth is using up energy.
Mm.
Or it could even be interfering with your body's ability to absorb nutrients properly. It's basically a signal that something internal isn't functioning quite as it should.
Wow, okay. Losing weight without trying is definitely a signal you shouldn't ignore, even if, like you said, you don't immediately link it to the colon. And finally, what about persistent physical discomfort? What does the source tell us there?
Right? Look out for ongoing abdominal discomfort. The article describes it as cramping or gas or maybe pain that just kind of hangs around. It doesn't resolve easily.
Just lingers.
Exactly. And it also mentions a feeling of being full or bloated, maybe quite quickly, even after eating just a little bit, which, the source says can sometimes hint at maybe a blockage or some kind of irritation.
Okay. So putting this all together, for you listening right now, why is being clued into these specific signs so crucial? What's the sort of bottom line this article wants you to take away?
Well, the core message is pretty direct. None of these symptoms guarantee something serious like cancer. Let's be clear on that.
Right.
But dismissing them, ignoring them, that can be risky. The article really underscores that catching colon issues early, especially colon cancer, dramatically improves treatment success. So these signs are less about self-diagnosis and much more about recognizing when it's really time to talk to your doctor.
Makes sense. So if we connect this to the bigger picture, beyond just knowing these potential signals, what does the source recommend? What are the proactive steps we should be taking?
Yeah, the article's conclusion is pretty straightforward and honestly powerful. Pay attention to your body. Simple as that sounds. And don't hesitate. Don't hesitate to bring any persistent or concerning symptoms to a healthcare provider. It strongly emphasizes that combining this kind of personal awareness with the recommended regular screenings, that's truly your most effective defense.
Awareness plus screenings. Got it. So what stands out to you after we've walked through these signs from the article? Here's a thought kind of drawn from the material we explored. How does simply becoming more aware, more tuned in to the specific messages your body might send, how does that potentially change how you think about, say, scheduling or even just approaching your routine health checkups and those recommended screenings? Something to maybe think about this week.